Just going to leave it one more minute. All right, I think we'll get started. So good evening, everybody. I am delighted to be here tonight. This is a very, very, very important topic I want to talk about. Just for those of you who don't know me, I am Dr. Tim Errington, the owner of Total Health. I've been doing these talks for quite a while now, trying to cover all the important topics around about spinal and postural health to help you all live a healthy life. Today we're definitely going to be learning something that is hugely important. These discs in our spines are very functional pieces of our anatomy. I think they're amazing. I really do. Think about it. There are 25 of these discs all on top of each other, and these are joints that can move in any direction. The engineering in there, the bioengineering, is incredible. But one thing's for sure, we have to look after them, or they break down. And I'm sure some of you on there know what it's like when your disc breaks down. These discs are the spaces between our backbones, and like most things in our body, it's a case of use them or lose them. And we simply need to keep them functioning well. And it's a matter of alignment, structural alignment, and functional movement. Okay, we're going to be talking a lot about that this evening. Unfortunately, we've created this very unnatural life, which is causing more and more problems, spinal problems especially. If anybody has any questions, and this is a big topic, so I'm sure there will be some questions, pop them in the chat and we will address them at the end. I've got a lot to go through, so I shall move at pace. Stay with me. Any questions, then just pop it in the chat. Okay? Right, pain, something that we all have. Certainly it's the main reason people come into my clinics. We suffer pain when a structure in our body cannot adapt to the stresses upon it, right? When we are moving through life, it puts certain stresses on our spine, and the body is designed to adapt to movement and to changes. But if we lose the ability to adapt, then we have problems, okay? It's a sad fact that 1/3 of all adults will have back pain in any year, and low back pain is the #1 source of disability right across the globe. And actually, in a lifetime, the chances of all of you out there having a serious incident of spinal pain in some shape or form is 100%. Okay, so this talk is for you. We all have discs, you've all got discs, and they all have to obey the same laws of the universe. Okay, now I'm sure some of you out there, I'm talking about discs because some of you have got or are worrying about disc problems. Maybe somebody out there has had that terrible situation where you've been suddenly hit by you've been stopped dead in your tracks, fallen to the floor, you're just completely locked up, you can't move, pain shooting down your legs, and you're basically stuck there. And you're thinking, oh my God, this is serious. Am I really going to have surgery? Well, the answer is yes and no. A very few people, and I stress that, very few proportion of the people that suffer this will need surgery, okay? Often the amount of pain that you feel is kind of disproportionate with the problem. And I want to explain this to you today because it can be very scary. And I believe that knowledge is power. And I want you to look at pain after today in a different way. Remember, Pain always means P-A-I-N, pay attention inside now. Okay. If it makes you feel any better, it might surprise you to know that if we took MRIs of people who were just walking down the street, asymptomatic, no symptoms at all, between 10 and 30% of them will have bulging discs. So they will already have some disc degeneration, but they've got no symptoms. Life goes on as normal. Okay, so that actually means that some of you today who don't think you have a disc problem will have one. I personally know that I have potentially got a disc problem. When I took my X-ray of my low back, I saw my bottom disc thinning. It doesn't surprise me because of the life that I've been through, and I'm pretty heavy on my spine. But I do employ everything that I'm going to be talking about this evening. I personally do, and it is my strategy to make sure I get through my life in as healthy a way as possible. Okay, so let's just look at these discs. Let's understand what they are. We have 25 of them. They're the cushions between each vertebra, so they're cushioning. And then with the curves of the spine, they act as a shock absorber. Okay, and as I said, they're really well engineered, and they're designed to meet structural and dynamic needs of the spine. They are strong enough to resist compressive force, and they're strong enough to resist movement along many different planes. So twisting and bending, they're designed for that. They're amazing things. They are designed to last a lifetime, right? And that's a long lifetime. But as I said before, our lifestyle has created some problems. And over time, we do see these changes to our disc, which gradually build up. These changes are structural, mechanical, and chemical. And if these changes are detrimental, then they will inevitably lead to pain. There's many, many nerves in these discs, right? So if they're suffering from problems, eventually those nerves are going to start to let you know. All right. Now, even slight changes to the nutrition and motion. So if you're not moving enough, you're not getting enough blood and nutrition in the discs, that's going to cause deterioration. And if you are not moving correctly, so exactly, for example, you might be sitting all day, compressing your back. You're not sitting in good posture. These are all things that will gradually and eventually lead to some deterioration in your discs. It's true that people like myself, people over 60, when you take an MRI, they nearly always have some signs of deterioration. But luckily, very few of us end up having pain. Okay, so let's learn about the inside of these discs. Two main parts. There's the outer part. So the outer part of the disc is called the annulus fibrosus, and it's a series of fibrous bands, and they are orientated in different directions. And so that is so that they can resist turning, twisting, bending, and all these things. Now, on the inside, you'll see, the inside of the disc is something called the nucleus pulposus. And think of it like, well, it has the consistency of toothpaste, if you like. So it's pliable and squishy, and it's held in place by a membrane, but it will squish. So when we move, this nucleus allows movement. So it'll squish on one side, but then it'll spring back into its rightful shape. To get a picture of what it might look like, think in terms of jelly in a donut. You've got the outer bit, and then you've got the soft jelly in the middle. Okay, if that helps create a picture, that's good. Now, vitally, something that you all have got to know, so important, we should be taught this at school, is that the discs virtually have no direct blood supply. They have a little bit, which I'm going to show you, but not enough. In fact, let's do that now. Here we go. So there we see the nucleus in the middle with the dots. Then we see the swirls around the outside. That's the annulus that gives it strength. Now you can see the blood. The blood is supplied mostly to the discs, mostly to the vertebra on either side. And you can see the little red arterioles. They're feeding the cartilage end plate of the vertebra. Now, there's only a little bit of blood coming around the side of the discs, and that feeds a little bit of nutrition into the annulus, but certainly not enough for these discs to stay healthy. It's absolutely vital that we get motion in these discs, because that creates a pumping action. And as we move, it creates this positive pressure, negative pressure, positive pressure, negative pressure. So positive pressure will actually pump out the waste products of metabolism. And then as it opens, because of movement, then that sucks in fresh blood. Of course, the blood is the carrier of the nutrition and oxygen and all the things that we need to be healthy, right? So correct full range of motion in all direction is vital for our healthy discs. And that's why our chiropractic adjustments so very, very important. As we age, we tend to stiffen. Yeah, we all know that. And if we stiffen when we don't have as much movement, correct? So this is dysfunction. And then our discs are not getting enough nutrition, so they start to get thinner. Okay, that's why people lose height. They lose height because of posture. So people have this bad posture, but also the discs get thinner and thinner and thinner. And you've got 25 of them. So if you lose 1 millimeter from each one, that's going to be an inch. Okay. The most common problems with these discs are the bottom two, and that's because we're sitting very heavily on them. Most of the time nowadays. So if we take a cross section across the spine, you can see the disc there. It's blue, the big blue thing, and then you can see the annulus around the outside and the nucleus pulposus in the middle. Now you can also see the spinal cord just behind it, and you can see the two blue spinal nerve roots coming off the spinal cord, and you can see how close they are to these discs. Literally only millimeter, 2 millimeters away. So it's very easy to see that if there's a problem with the disc starts to bulge at all. You can see how these discs can start pressing on nerves, right? Again, if we take a closer look, a closer cross section, then we can see a nucleus pulposus. This time remember this is the toothpaste in the middle, inside the green annulus fibrous outside. Here, the nucleus is actually leaking through some, obviously there's a weakness. Now that weakness could be due to trauma, it could be due to poor nutrition, bad alignment, it could be due to a few different things. What you can also see is some nerves in there. You see the nerve around the outside of the disc in orange, feeding little nerves into the annulus. Then you can see how a failing disc can start to sort of light up the nervous system, and you can start to become really aware. In this particular case, the disc is starting to bulge a little bit, and you can see how there's a little scar in the nerve at the bottom there. It's just starting to press on a nerve. So you might start to be getting some symptoms. If we take a cross section, now this will be an MRI from one of my clinics, we can see 3 unhealthy discs. If you look at all the discs, most of them have got a sort of a whiteness, they're light. And then those 3 unhealthy discs are dark, they're going black. Now, what that means is that they are desiccating or drying out. So that tells me immediately that there's not enough movement in these areas. So what could be happening? Well, maybe that person is sitting all day without moving. Maybe the scar tissue in that area. So maybe there's been inflammation over a period of time, which attracts fibrosis or scar tissue. That increases the rate of stiffening. Not enough movement, the discs start to get thinner, and then the weight makes them bulge. and you can see them just starting to bulge a bit into the central canal. And the one at the bottom, where with the ring it says herniated, then it's starting to press on the nerves. If we sort of look at an illustration of how that might look, you can see here that there's the red herniation is actually squeezing out of the disc, and it's putting direct pressure on that nerve. This is very, very, very common nowadays with people who are sedentary, sitting all day, all you office workers, and then suddenly you find yourself traveling, and before you know it, you're leaning over a carousel, and you're picking up a heavy bag and twisting at the same time. This is a recipe for a disaster, right? I'm going to teach you some tricks today so you can help avoid these things. Okay, if we look at what's going on with a serious herniated disc, you can see it there. This time the nucleus is in the middle, the tooth base is in purple, and you can see it's pushing right through a tear in the outer annular fibrous rings. And you can see that the nerves, which are the yellow dots, they're being irritated and becoming red. You can see that. And this herniation, this disc which has failed, and this is what is referred to as a slip disc, doesn't actually slip anywhere, it actually fails, it changes its quality, and there is a structural failure causing the nucleus to squeeze out. Here it's affecting both the nerve root, and you can actually see it squeezing into the spinal cord. Another MRI from my clinic, this is quite a serious situation here. You can see that there's a big herniation, and you can see it pressing right on that spinal cord there. Obviously, this is not a comfortable situation to be in. Okay, so let's think about some of the perhaps symptoms that might happen if you get a bulging, or worse still, a herniated disc. Well, these might vary depending on the position of the hernia. Is it coming out the left? Is it coming out the right? Is it coming straight out the back? Is it even coming out the front or the side, where there's going to be less involvement of nerves? The amount of herniation, how much is it being squeezed out? And then, of course, the level. The spinal level is going to determine some of the symptoms. You can actually have herniations in the neck, and that's going to affect perhaps the arm. Or the shoulders. You can have herniations in the low back, which is going to cause sciatic pain, as you can see here, or it could even be affecting the bladder, or digestion, or sexual activity, anything like this. There's some very, very important nerves in these important areas. Okay, think in terms of something that's out of position, and it's filling a space which is occupied by a nerve. Okay, and of course these symptoms can be literally anything from non-existent to mild to medium to absolutely excruciating. I hope nobody on this call has experienced that. So what might you also experience? Well, we know that you might have pain down the leg, but you might also have numbness. You might have paresthesias, which is tingling. You might have weakness. So muscles actually start to atrophy, or they become actually weak, and you can't, even sometimes you actually get foot drop. You can't lift your foot up because the nerves that do lift your foot up, they're being compromised. Okay, these situations it's called radiculopathy, when the dysfunction is radiculating or radiating down the extremity. These things can come and go, depending on your position, on the severity, on the amount of inflammation. So there are various things. Some people, will notice that they have good days and bad days. And really, it's very, very important that if you're starting to get these symptoms, that you get onto them, because it is the body telling you something is wrong. Okay, it may be difficult to lean forward. When you lean forward, you're putting more pressure on the discs, right? That's going to push the discs backwards. You might have more pain if you're straining. So, for example, if you're sitting on the toilet, straining, that could increase the pain down the leg. That is a sure sign that it's a disc problem. Coughing and sneezing. So, achoo. That again, if you get a zinger down the leg, that's highly, highly indicative of a disc problem. All right. And if you have this disc problem, you have to come in to one of our clinics. All right. That's just, you know, it really is a rule, because you've got to stop things from deteriorating. If you get pain down both legs, then you're talking about a much bigger herniation, a much bigger prolapse of the disc. And it's either affecting both nerve roots, which is probably unlikely. It's more likely to be straight out the back, and it's putting pressure on the spinal cord. Okay, it's a sign of that this is perhaps getting a little bit more serious, because we've got cord compression. All right. Here's a representation. You can see what happens in the neck. So this is, you can see the brain at the top, the cerebellum, you can see the chin. This person is looking to the left. And what you see here is that this person has developed a forward head, and all the weight has come on the discs. This person has lost the natural spring that a curve gives the neck. All the weight is on the disc, and eventually the disc has failed. And you can see the black disc being squeezed out the back, and it's seriously pressing on the spinal cord. This again, you know, we're approaching a medical emergency here. We've got to avoid things deteriorating. Okay, I've got my magic pointer there. There is the slip disc. There is the prolapse, the herniated disc, and you can see it's damaging the spinal cord. Very, very dangerous. Okay, and when we look at the nerve chart, and we look at all these different levels in our spine, and then we look at what happens in and around our spine, our entire life passes through the spine. It's our main structure that protects our nervous system. And then all the nerves come out from each of the levels, and all these little nerve roots, they need enough space. And what maintains the space? It's the discs. So if you start developing stiffness or poor alignment, these discs are going to suffer. They're going to become thinner and thinner and thinner. And then any of these nerves can become compromised. These nerves might be going to your liver or your lungs or your heart, digestive system. They could be going anywhere. So, you know, we need to understand how to maintain our spine, and especially our discs. You may have seen people, or maybe it's happened to yourself, develop it's called an antalgic lean. So pain is forcing you into a bad position. When somebody comes into our clinic looking like this is a sure sign. This person's disc is certainly out on their left side, and so they're leaning over to their right to keep the pressure off the disc, if that makes sense. So anybody that comes in with a presentation like this, they are going straight for X-ray, because we need to see what is happening. Some people come in and already they've had surgery. I see incidents like this all the time. Most commonly L4, L5. These are the joints at the bottom of your spine. They're movable joints. It's the lower two movable joints. When you're sitting all day, when you're slouching, all the pressure is on these discs. No movement to bring in the nutrition. Oh, it's a disaster waiting to happen. So here they've chosen, unfortunately, to have spinal fusion. Spinal fusion they do by either screwing it together, like you see there, or sometimes they do bone graft. So they might take some bone off your femur or off your hip bone, and then they attach it between your backbones, so it takes and they actually use your own bone to create a fusion. Other types of surgical intervention, one is called a laminectomy. So a laminectomy is when the spinal cord is going around a failed disc and it's getting squeezed at the back of the spinal canal. They actually cut out the lamina. So they cut out some of the bone to create more space so the spinal cord can go around the slipped disc. All right, it's not fixing the cause of the problem, it's buying a bit of time. But again, you do get some relief in the short term. Another thing they do is a discectomy, where they go in and they often use lasers, but they basically trim the disc where it's bulging out. Obviously, they're not addressing the cause of the problem. People tend to think of it when they go for surgery that it's like, I'm going for surgery. It's a once in a lifetime thing. Once I've had surgery, it's done. I should be fine. Well, the problem is 25% of people, I'm afraid, who have surgery, there are some kind of complication. And then there are other complications associated with the fact we haven't fixed the cause of the problem. There is something called adjacent segment disorder. So you've got two joints that are screwed together or immobilized. So that means you don't have as many joints in your spine. So the joint immediately above and below is doing twice as much work. So you can, whatever was going on that caused the problem in the disc, or in this case it was L4, L5, they've screwed them together. Great. Well, now what's going to happen to the joint between L5 and the sacrum, or perhaps L4 and L3, right? So they're going to go through, experience a lot more force, and they are subject to deterioration and possible failure. Okay, so I want you to understand that most of our clients that come into our clinics do not need surgery, and statistically 60% of our chiropractic patients will have as much relief as surgery. All right, now remember, our people won't have, 25% of our people won't have complications. Now, of the people that come in to our clinic, as I said, most people will have relief. Most will have relief. Of the people who have got these very, very bad backs, only 5%, so that's 1 person in 20, is an ideal candidate for surgery. Now, why is that? Well, because of various reasons. One, it's the deterioration has gone a long, long way, and it's, the whole thing is downright dangerous. And so 95% of people should be trying to find alternative. And it turns out those who don't have good results, I'm trying to get my words right here, I want you to understand it. Most of our people get better. The people that don't get better, and that might be only 5%, they are the people who are the good candidates for surgery. Does that make sense? So if there's 20 people, 19 people will get good results or reasonable results, enough to save them from misery, from chiropractic or spinal manipulative therapy, certainly going down the natural route. But of the 1 person in 20, that 1 person in 20 is the ideal candidate for surgery. Okay, now what this means is that people should certainly try more natural ways first. I hope that makes sense. What we do know is that non-invasive conservative treatments, so we're talking about manipulation, strengthening, stretching, some modalities, making some healthy changes to the adaptive capacity of your spine, then you will start to heal. Okay, always remember, the body wants to heal, if you take away the cause of the problem. Any questions on this, please address that in the chat. There are some common risk factors, including age. People in their 30s and 40s are quite at higher risk. People who are sitting all day, people who are doing heavy lifting. These are the people who are under, who have a lot of risk for problems. So, I live in Singapore. Everybody I meet seems to be working at a computer all day, every day. If you think this must be you, then please remember this is the #1 cause. This will be causing degenerative changes unless you have a strategy to maintain a healthy spine, right? This is poor alignment and poor movement. Those are the two things which go together to create a time bomb. Okay? So let's just think how we can start to treat this problem if there's a problem. Okay? And please know that with proper care and allow enough time for change, you can get your life back. Okay? So first, some do's and don'ts. Remember, we're talking about a degenerative process. So whatever that is, we've got to slow it down, we've got to stop it, and we've got to reverse it. We've got to do everything we can do to reverse the process. So what does that mean? Obviously, we've got to improve alignment, posture, habits, so sitting, things like that, and our posture, and we've got to get enough movement back into our spine so it's living again. It's getting enough blood and oxygen and nutrition. All right. Most discs are drying out and thinning due to poor movement patterns. So we've got to think about our movement patterns. We've got to think about our daily lifestyle, and we've got to start exercising. We need to move more. If you're sitting all day, you've got to stand up more. We've got to somehow get the weight off the front of the disc, which is pushing these discs backwards. We've got to move. We've got to sit up, put a curve back in our spine. We've got to give our spine a chance. Exercise. We are recommended to be exercising. So think in terms of walking. If you've got a bad back, if you can walk, great. So recommended 150 minutes a week. So 5 times 30 minutes. That would be good. It doesn't have to be much more than walking. But remember, you can walk with bad posture, so try not to do that. Engage your abs, lift your sternum, and try and walk nice and tall, in good posture and good alignment, and try and make it vigorous and with some good healthy movement. So because that's encouraging the discs to live. Okay. Please remember that whatever you do now is going to pay huge dividends later on. I'm sure I'm talking to a lot of people who don't have serious problems, but probably have stiffness and occasional pain. Please listen to your body and just make sure you get full range of motion back, and make sure you address your daily lifestyle to get movement in there. Otherwise, your discs will desiccate, and then one day they will fail. Okay. So let's give you my top 10 things that we can do to strengthen our spine, to move the discs back into a state where they can start healing. Okay. First of all, we need to tighten those abs. So maybe doing planks or whatever, but certainly sucking in and making sure that our spine is supported all the way around. Most people, unfortunately, develop very tight back muscles, and then due to a reflex action and their sedentary lifestyle, we get very weak abs. So we have to stop that. We've got to get some strength back into our abs. So just simply doing some planks. I got into the habit of doing 2-minute planks long time ago, many years ago. And I pretty much do it every day when I remember, and it saved me. I mean, I'm lifting clients all day, every day. Without looking after my abs, I would have had some disc problems before now. That is for sure. So we've got to think about posture. We've got to stand up straight. When you're leaning forward, it's putting pressure on the discs. Okay, so we've got to address our posture. I tell people to remember where the sternum is. If you lift that sternum up, engage your abs, pull your head back, you are in good posture. If the sternum drops, then everything is bad. You feel the pressure go onto your low back and you feel your head go forward. So stand up straight. Take a load off. So if we are overweight, this is a bit of a no-brainer. If we put on weight, I'm afraid that extra weight goes onto the discs and it all goes through those bottom discs. Okay, so try and keep your weight down. Lifting, I'm going to talk about that with a slide in just one moment. But the rule is, don't be lifting with your spine, don't be lifting with your back. You want to be lifting with your legs. In a moment, I'll show you how to do that. If you're going from not moving to exercise, or you're going to do something active, then please warm up. Please make sure you're getting as much movement in there, get some blood and get some nutrition in those discs, because they are, remember, they're drying out when they're not moving. And if suddenly you go on the golf course and you don't warm up and you just do a big swing, you know, that is a time when it's very easy to rupture a disc. All right, please warm up. I mentioned exercise. Find something that's fun, you know. Make sure you're exercising at least 3 times a week. Make it fun, plenty of movement. Try and exercise for at least 30 minutes in one go. As I mentioned before, in total, we're looking for about 150 minutes a week, minimum of good movement. Okay? Make sure you're getting enough rest. If you're doing something strenuous, then be careful. That's when you might injure your spine, and make sure you're sleeping properly at night, right? If you have pain, then you need to understand how you can sleep without pain. We can help that. Certainly, you might need to perhaps check your mattress, because if that is hammocking, if that is collapsing so that you are sagging, we call it hammocking. That's putting a lot of strain on your ligaments. It's putting a lot of strain on your discs. All right, maybe it's time for a new mattress. And please don't soldier on. If you're getting some symptoms, please do not stiffen up, because things will only get worse. You need some strategies, please. We are here for you. I'm going to make this presentation available for everybody as a PDF, as reminders for you. But please, if you're getting symptoms, if any members of your family are starting to get symptoms of stiffening and pain, please address them before you have a failure of a disc, because once you've got a disc failure, it is something that you will be managing for the rest of your life. Okay? And please see a spinal expert, and be very careful who you listen to. All right? That's definitely more, top of my bits of advice. Please be careful who you listen to. Right, so let's think about some exercise and protocols to prevent, manage, and relieve disc problems. Number 1, I'm a chiropractor. I'm a huge proponent for spinal manipulative therapy. I've been doing this for over 20 years. It simply works. Why does it work so well that probably 90 to 95% of spinal disc problems will heal under chiropractic care? Because it's doing everything that needs to be done. It's restoring posture, alignment, and movement patterns. That, together with exercise and strengthening and dynamic stretching, and the regular exercise that we recommend, we are moving our spine back into a functional state where it can start to heal. Okay, this is why chiropractic is rapidly becoming part of functional medicine, because it's natural. It's what people actually need. People, when you have pain, when you are suffering, you only need pain as pain relief, or maybe an anti-inflammatory in the short term. We want the body to heal. We don't want unnatural and dangerous chemicals that are addictive to become part of our lifestyle. all right? So I understand if you're in terrible pain, you might need some short-term relief, but please understand, nearly all these drugs are addictive. The body gets used to them, and you need to take more and more and more, okay? So think short-term for any drugs. Be very careful about going to see an orthopedic surgeon or down that route. I'll tell you the instances when you do need to go see an orthopedic surgeon. But initially, please seek a natural solution. Okay. You want to be doing something that is movement-based, because movement is what you need. We're talking about structural problems that need a structural solution. Okay, chiropractic safe. We restore function. We are restoring the blood flow, the nutrition, oxygen, etc., to the tissues that have been damaged, and we're creating space for these nerves. Okay, so that relieves pressure off the nerves. All these allow the body to heal. Okay, hope this makes some sense. Right. I'm going to run through some things you can do, some simple exercises that you can do. Again, I will make these available as a PDF for you at the end. Okay. So if you've got some back pain, if you've got some pain going down the leg, this is a great thing to try. Just get your legs up like that on a chair like that, 90 degrees. This will take some pressure off the lower back. You can even raise the chair and actually hang a little bit from your lower legs, so you get a gentle traction of the lower back. You might find this very, very relieving. Okay, when you lift your legs up, it's taking a lot of pressure off this area here that you can see with my pointer. Okay, while you're lying on the floor, you can try pulling your knees in, and you can just gently pull your knees all the way to your chest. Listen to your body. If it increases pain, then stop. Tell us. But you might find this quite relieving. If it is, great. Something you can do every now and again. You know, every couple of hours, you can lie down, get a yoga mat, just pull those knees in. In that position, you might want to try rotating your knees from side to side, just getting some gentle movement into those discs. Again, always listening to your body. All right. If it's slightly uncomfortable, okay, just keep with it. If it's very uncomfortable, you know, real pain, then stop and talk to us. Okay. If you can do this, then you go up to the next level where you're pulling one leg up and then you're dropping it across to the other side. Okay. You can gradually increase the stretch, and you can understanding the feel of your low back, you can direct the stretch right into the tissues around your low back. Okay, we want to gradually increase more elasticity in both directions. Most of you will know what a cat and camel stretch is. I know you can see that there. So just while you're on all fours, just drop your spine down so your belly sags. That's putting a nice curve in your low back, and then you go up into the camel and you push all the way up, and again that puts pressure, sort of squeezes the discs. So by going up and down, slowly listening to your body, that's putting a pumping action into those discs. Remember, that'll bring in the vital nutrition. Okay. While you're in that position, you might drop down into a child's pose. There it is there. When you're in that position, just crawl your fingers forward and gradually open up your low back. I think you'll find this is helpful and relieving. Okay. Now, because the discs are at the front of the spine, you certainly want to be trying some gentle extension. So the top one is a modified cobra. So you're just easing yourself up on your elbows, putting a gentle curve in your low back. If that is not painful, then gradually you can just ease yourself up a little more. It's opening up the discs, okay? Sucking in nutrition. If it is causing local pain, then you know that's irritating the joints in your lower spine. Then don't push it that far. Okay. We also, I've mentioned this, that we want to have core strength. So I mentioned the fact that I do my planks. I do my planks on my elbows. I do them for a couple of minutes. Most days, I'm not saying that you should be doing 2 minutes. I really do have to be careful with my back. While I do it, I lift my feet from side to side just a few times, and that makes the whole thing a little bit more dynamic and works the reflexes at the same time. Okay, planks, very, very good thing to do. If you've got a bad back, probably better than doing crunchies, right? Sit-ups. Get used to sitting in great posture. So you just sit down, put yourself in great posture. You can see the lady on the right, and try just engage your abs so it's supporting your spine. Suck those abs in tight. Lift your sternum, pull your head back, and sit as tall as you can with your legs at 90 degrees. I hope some of you are doing this right now. Now, in your mind's eye, extend your spine. So just allow your head to move north. So you want to sit as tall as you can so your head moves towards the ceiling. Just do that. Just practice doing this at your desk when you're at work or wherever you are. It's very good for your abs, it's very good for your awareness, and it's just very good for conditioning your structure. Okay? While sitting, and we do a lot of sitting, I know, then you try and spend a bit of time with more dynamic sitting. So I'm a huge proponent for exercise balls. I like exercise balls because I find it hard to sit on an exercise ball without moving. You tend to bounce a little bit, you tend to move from side to side, backwards and forwards, round and round. These are great things for strengthening the core, improving balance, reconditioning, and vitally getting all that nutrition into the discs. Okay? Right, I've gone back. These are the exercises. This is where you should start. Now, of course, when we do anything, we've got to think safety first. Okay? It's very easy to get overconfident, very easy to go too far and overstress these discs when they've already started degenerating. So just easy way into the exercises. Start small and build up. Okay? Take your time when you begin. Don't push yourself too hard. Always listen to your body. Okay? If you feel any pain, remember a little bit of discomfort, it might be okay. Okay, a little bit. When you stretch, we certainly should be stretching into slight discomfort, but we should not feel pain. All right. If you are getting any pain or any long-lasting pain or anything makes things worse, then please have a word with us or your chiropractor. Okay. I mentioned lifting. Please lift carefully. Parents, it's dangerous having children. We know that because you spend a lot of time leaning over them. Whether you're weaning them or whether you're lifting them all the time, you spend a lot of time leaning over them. As they start to get bigger, they're heavy to lift up. When you lean into their cot to pick them out of bed, be very, 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 very careful. Please avoid hurting yourself when lifting anything, whether you're at work or whether you're at home. How do you lift? You lift not like the guy on the left in the illustration. You lift like the guy on the right. Okay? Whatever it is, child or a box, shopping, whether it is if you're bringing your carousel your case off the carousel at the airport, be very, very careful. Try and lift with your legs. Okay? Bring it to you. Come down to it, bring it in, make sure you've got a curve in the low back so that all the pressure is not on the discs, and then lift with your legs. Okay, please, that's very, very important. Okay, I mentioned that there are instances when you should see an orthopedist. All right, so I have had clients over the years that have needed surgery. They tried chiropractic first, it didn't work, but what we found was that the chiropractic actually made the surgery more successful. They had better movement in their spine, they knew that there was better delivery of nutrition, etc., to the area, and they'd been practicing some good habits, so they'd already strengthened their spine. So this made their surgeries more successful, okay? So always try non-invasive chiropractic first. So, but there are instances when you need surgery. Okay. Number one, go and see an orthopedist when the pain is always there. Nothing relieves it. You've tried everything, and you've tried all the less invasive things, whether it be acupuncture, chiropractic, physio. You've tried it all. Nothing works. Life is miserable, and you've given it enough time. Okay. But do remember there is always risks with surgery. 25% will have some kind. I'm not saying it's always going to be at 25%. It's going to be a disaster, but there are complications. Okay, whether it be infection or things like that. And do remember, when you have surgery, there is no going back. Okay. Other instances where you must go for an orthopedic consultation. One, if there is pressure on nerves and you have urinary or bowel problems, so retention, you can't go to the toilet, or incontinence, and anything like that, then that's probably time to speak to a surgeon. All right. And then the final one is something is quite rare, but it can be a medical emergency. It's called Claudia Cauda syndrome. The Claudia Cauda is the bottom of the spine. It splits into, it means horse's tail. The bottom of the spinal cord splits into like a horse's tail, and all these become nerve roots. If there's pressure on these, then and it's serious pressure, then it can be causing some serious problems, leading to incontinence or paralysis of the legs, or anything like that. The first thing you will notice is something called saddle anesthesia. So you're getting numbness if you imagine you're sitting on the saddle of a horse where the pressure would be. So it's in your derriere, your backside, and the inside of your legs. If you're getting numbness there, it's called saddle anesthesia, then we know that there is pressure on this horse's tail at the bottom of the spinal cord, and this is definitely a time for orthopedic consultation. Okay. Moving towards the end, just some very basic takeaways. If you are suffering from a disc problem, it may seem like your life will never be the same again, but please understand your body does want to heal, and your body can heal. It's got all the tools. It's designed to heal. Okay, so always choose non-invasive first, unless you've got one of the red flags, which I have mentioned. Please try non-invasive first. Okay, don't wait for it to become an emergency. Please think about having a second opinion. You might have already spoken to a surgeon, and they're saying, yeah, you need surgery. Well, of course, you're talking to a surgeon. Most people with slip discs go to a surgeon. I say most, probably 60% end up having surgery. 60% go for surgery, whereas maybe only 5% that come to a chiropractor might eventually need surgery. Okay, really important that you understand that. So I'm moving towards the end now. I'm going to have a look at my chat to see if there's any questions. Please, if you know anybody that needs our services, anybody who's suffering from what might be a disc problem, please get them into our clinic. Here is a QR code that will help people find their way into any of our 4 clinics. Remember where we are. We're in CBD, we are in Clementi, we are in Topaio, and we are in Tampines. Okay, just click on that. You can find us on our website. If you go to website, there are phone numbers. Please, I do not hide. I will answer any questions. I am here for you. Okay, so I'm just going to have a look at the chat, see what's there, if anything. Okay, let's have a look. Oh, I've got a whole family watching. Good for you guys. Cannot hear, can hear. Okay. Hopefully that wasn't me that was causing a problem. It seems okay for everyone else. Can you look at, oh, sorry, volume. There are many kind of supports available for the back, buttock, and neck. Do you recommend or discourage use of such products? Okay. Right. Very good question. If you have a back problem or you have a weak back, and perhaps you might be doing, well, going shopping, and you're going to be lifting heavy bags, and you know that it's going to cause terrible pain, and then please feel free to use a back support. There's many out there. Most involve a strap that sort of goes from there to there. It straps your low back. It involves Velcro. It's basically doing the job that your muscles should be doing. Okay. If you're perhaps a weightlifter and you've had a bad back at the bottom, or you don't want to develop a bad back, then again, a lumbar support might really work. So these are definitely cases where I think it is a good idea. I don't want you wearing it all the time, because I want you simply must get core strength back. If you've got a bad back, almost certainly you've got some weakness in the supporting structure, and there is various inhibitory factors going on. We've got to get function, we've got to get movement going on, and we've got to get our abs fired up to support the spine. Okay. So yes, the low back supports are good for certain instances, mostly as a protective thing while you're doing something active. Okay, shopping or whatever. Some people who have to drive, they may find that very painful. They can put a nice like a corset, a tight corset around their low back. It might create some support for the back while you're driving, but not all the time. My friend bought one of those hanging Y strips online, which hangs from the ceiling. Is it safe to do? Okay, look, I don't mind hanging as a thing. I used to hang upside down by my ankles. I'm certainly not going to recommend it for everybody. I was young and fit. I don't have anxiety attacks when I'm hanging upside down. For some people, it can help. Simply hanging from a bar by yourself, if you can do it, that can also help. Hanging by your knees can help. But please, you've got to do this carefully. You need somebody with you when you do it. Ideally, do it in the gym, and you've got some kind of trainer with you. Okay, please be very careful. My nephew is serving national service now, and he got hurt during training. Let me doctor, this is minor slip disc, and sent him to see a physiotherapist and to strengthen his back muscle. Does it sound right for you? I think it's right that it's highly likely that somebody who goes to national service is running around with a 24 kilo pack on their back, jumping and doing all these activities. They're thrown into it. They haven't been gradually strengthened. So yes, it does happen. I have lots of NS young men coming in to see me at any one time. So should they be going to a physio? Well, a physio is for soft tissue rehab. It won't do any harm. But I do believe you need some spinal manipulative therapy at the same time. You might need some traction. You certainly need somebody who knows more about the actual spinal structure and not just the muscles. Okay, so a physio, they can try the physio. Very often it's not enough. Very often a physio and a chiropractor can work together. Certainly in our clinic, we will manipulate the spine. We'll do everything that we need to do to restore function, and we will give all the treatment and stretches and all the rehab will be recommended by us. Okay, but yes, it is absolutely right that they need to strengthen their back before they go back into all this heavy lifting. Okay. What else we got? I'm a bit overweight. Can I still jog, run? My back tends to hurt after I run. Okay, well, always listen to your body. If your back's hurting, then listen to it. What is it telling you? If you're a bit overweight, then try and get that weight off. There are ways. If you've tried everything to get the weight off, then please come and see us. I've got methods that work every time. All it needs is a little bit of willpower, all right, and a couple of months. You just need to do it. Certainly, I don't want to stop you exercising. I want you to listen to your body. I think it's likely that you need to strengthen your abs. You might need to think about your form, the actual the alignment that you're running in. Perhaps come in, make sure you're getting checked out. If there's anything wrong with your spine, any twists or anything like that, that might need to be corrected as well. Okay. All about structure and function and movement and core strength. Is cycling good or advisable to cycle for back pain? Yeah, I never tell people not to cycle, but I do tell people to cycle in good form. Cycling can involve lots of leaning forward, so sometimes you've got to push away a little bit, make sure, and without putting all the weight on your wrists, introduce a little bit of a curve in your back. Try and sit it up a little bit more. But really, cycling, it can be good, but it can also be bad if you've got a bad back. If it's part of your solution to staying healthy, then all very well and good. But if you've already got a good back, then please, no bending over. You need to sit up. Probably not so much a racing bike, more of perhaps a mountain bike, so you can sit up more. That would be definitely my advice. Cycling good and not advisable to cycle for back pain. Yeah, if you've got back pain, just be very careful. Listen to your body, and perhaps if what I've said hasn't been enough, please come to me. Please contact me. I'll help talk you through it. Okay, I think that's everything. I've gone through a lot of stuff there. I'm going to make this whole presentation, all the exercises, everything I've gone through. I'm going to put it on a PDF so we can send it to you if you do so request. Okay. So thank you very much. I've enjoyed this presentation greatly. It will be loaded up to our YouTube channel over the next couple of days. So if anybody needs to hear it again, or you need to forward it to somebody else, then that is where you will find it. Okay, so thank you very much for staying with me. I do appreciate me. There's been 27 people on, so that is well done to all of you. I think we've done some good this evening, and I wish you a very good night.